Our medical correspondent Nicola Hill joins us from London. Nicola, what exactly has this study found?
Well, as you've said, Rachel, there were 175 people who had mild to moderate COVID-19 at this hospital in Shanghai. And they looked at the blood samples of them after they'd left hospital, during the hospital and when they left hospital. And they found about 30% of them showed very, very low levels of antibodies. And in fact, 10 of them sort of hardly any level whatsoever, which obviously does raise this question, does it mean they're more vulnerable to reinfection? And this is something we all want to know because of the possibility of these immunity passports. And this is really something that has, as you said, it's caused a lot of discussion on Twitter with quite a lot of scientists trying to find out, exactly the veracity of this study.
So what does it mean then for people who've been infected? Can they be reinfected?
Well, this is a question that I put to Professor Annalise Wilder-Smith, who's a professor of emerging infectious diseases at the London School of Tropical Medicine here in London. And she was very keen to, first of all, mention that this is, as we said, a very small study. It's only 175 people. Also, this study hasn't been peer reviewed. It hasn't gone through the very rigorous deep dive into the data that normally happens with scientific studies before they're published. But what she did say is that what's interesting is the fact that it's the younger people here who had these low levels of antibodies, and the older people had much higher level of antibodies. And ordinarily, this would be the opposite way round. The older you are, the less robust your immune system is, and younger people normally do produce many, many more antibodies. But that's not the only part of the immune system. We also have T cells, which also fight infection. So she said there is a suggestion that possibly that might have come into play. But then she told me that I really needed to speak to an immunologist, Professor Martin Bakken from Bern University Hospital in Switzerland. So I spoke to him this morning and I asked him about this, and he came up with a very interesting theory. He wasn't that concerned, which I think is very important for us to be aware of. And he said it may well have just been the case that these older people may well have come into contact with much more infection. And so because of that, that's why they made more antibodies. He said the same as Professor Wilder-Smith. This is a small study. It actually needs to have a much greater study to see if there's a possibility of reinfection. Now, he wasn't ruling it out, but he said that's why we need to really have a vaccine, because that's probably the best way to prevent reinfection.
Okay, so that's my next question. What does this mean for the development of a vaccine?
Well, this is something that the study's authors speculate. They do say that you need to make sure that any vaccine is going to produce large amounts of antibodies. And if being infected wasn't doing this, would it have an impact? And does that impact on the threshold of antibodies any potential vaccine has to initiate? But again, Professor Backman wasn't so concerned, because he said that there are vaccines against diseases which the body doesn't ordinarily make antibodies against. Now, he gave me as an example the human papillomavirus. This is the one that causes cervical cancer and it causes cold sores. And apparently, when our body comes into contact with this virus, it doesn't automatically make antibodies against it. But if you're vaccinated against it, which these vaccines were developed, I think about 10 years ago, it then does work. Your body then creates the antibodies. So Professor Batman said to me, you can create a vaccine that will help you produce enough antibodies. So if your body then comes into contact with the infection, it can fight against it. And the other interesting fact that he told me this morning is that this virus, he said, is generally quite stable, which to him thinks that hopefully once they have created a vaccine, it's a bit of a one hit. And it's not going to be like flu, where you have to have a different vaccine every year. But as both professors said to me, we really don't know a lot. This information today just adds to the knowledge we're learning about COVID-19, and that's why it's being shared globally.
Hill in London, thank you.